Have you ever heard of blood flow restriction training? If you haven't, you may want to stick around to find out what it is. I'm Dr. Ryan, physical therapist, and I help clients get over knee pain and get back to the activities they love. BFR, or blood flow restriction training, is something that I use very frequently with my clients to help them achieve this goal. So you're probably wondering at this point, what is it? Blood flow restriction training is a method in which we use a specialized tourniquet wrapped around the limb to partially occlude blood going into the leg and fully occlude blood leaving the leg. This may sound a little crazy at first, but we actually use specialized technology that helps dial this in to each person to make sure that we're doing a very good job of personalizing it to you and we're not fully occluding your leg of blood. This does not look like voodoo bands that you're just tying tight around your limb, or like you may see some people doing in the gym where they're just really cranking something around their arm and doing some curls with. This is specialized technology that acts like a blood pressure cuff to determine what the pressure in your limb is. And then based on what the practitioner is putting into the system, that's how it's determining how much blood it's going to occlude during the exercise. So from there, we then do exercises with the client under partial occlusion, which creates an environment of fatigue around the muscle, tricking it into thinking it's further along in that process than it actually is. So why would we want to do this? Why put a tourniquet around someone's leg and go through resistance exercises, which obviously can be uncomfortable? BFR is actually a game changer for people that are having knee pain and can't tolerate regularly loading their leg. With blood flow restriction training, you can make progress with as little as 50 to 80% less weight compared to lifting heavier loads. So in terms of 1 rep max percentages, a 1 rep max is how much weight you can push one time for a specific lift. So for example, if you can lift 100 pounds during a squat and that's as much as you can do, with blood flow restriction training, you can make muscle improvements doing just 20-pound squats while under occlusion in that scenario, and up to 40-pound squats. If you're doing heavier strength training, you would need to be lifting 70 to 90 pounds for multiple repetitions in order to make improvements in your muscle. So it really allows us to reduce the amount of load going through a joint that is either painful, has arthritis, or has some other injury that's not allowing that person to exercise for whatever reason that may be. You might be asking, how does this actually work? How does this make changes in your body? And the answer is, it's very complicated and one that is still being researched in the world of science. But what we do know is by restricting the amount of blood going into the leg and all of the blood from leaving the leg when we're doing weightlifting exercises, it essentially creates an environment around the muscle cell that tricks it into thinking it's much further along in the strengthening process. So what's happening is there's less oxygen and nutrients available to that muscle cell, because as we do repetitions of that exercise, normally that blood would leave that leg or that limb that is being occluded, and new nutrients would come in, which allows us to exercise for longer periods of time. But since that is not happening, all of the byproducts from that muscle using energy are getting trapped around the cell. That creates cellular swelling and a whole other series of cellular cascades that I'm not going to go into right now. But what on a little bit simpler level happens is it just creates a whole bunch of fatigue for that muscle, so it's working a lot harder. It also switches us from quickly using type 1 muscle fibers to type 2 muscle fibers when using light weights. This typically only happens when we're doing high-speed activities or lifting really heavy weights, allowing us to make bigger gains in strength and muscle size while just using 20 to 40% of a 1 rep max load. So there's less pressure going on in that joint, and the muscles are working as if they were lifting heavier because of all of those changes that have occurred. Now, this is not a magical device. You still have to work hard when doing blood flow restriction training. You still have to put in a lot of effort, and it can actually be a little bit uncomfortable, and some even say painful, because the muscle themselves are swelling a little bit, getting bigger, and getting very fatigued. So if you're doing this in your leg, typically your quadricep and thigh muscles tend to get very tired very fast, and pushing through that requires a lot of willpower to be able to do it. But the nice part is, typically these people are not having pain in their actual knee while they're doing the exercise. So it's much more tolerable than dealing with that everyday pain that they're used to. Over time, they're able to actually build enough strength that that knee is much more supported and is no longer having pain with those day-to-day activities that typically would cause them discomfort. You probably have seen it in mainstream media that elite athletes are using it for their training, and while that's very true and a very effective use of it, it's also very common for people to use it after or before surgeries. So someone, if they just had a ACL reconstruction, for example, is a very large population of using it. But one area that's growing a little bit more research in and is very effective with my clients is people that have knee pain due to arthritis, meniscus issues, or tendinitis, and just can't tolerate loading their knee. We find a lot of these folks do really well using blood flow restriction training because they're able to exercise that limb and get stronger over time and reduce the amount of load going through that arthritic knee or through that tendon that has tendinopathy, not cause the pain during the exercise, get stronger over time, and then eventually wean off of BFR for many of these people. But for some people, it becomes part of their regular routine. So if you found this video helpful, I want you to subscribe to the channel and like it. You can leave a comment below with any questions, but there's gonna be a whole host of other videos coming out on what blood flow restriction training is and how we use it with different people and in different settings.